Measles is a serious infectious disease caused by a virus. This virus lives in the mucus of the nose and throat of infected people. Measles is highly contagious, meaning it spreads very easily from person to person. Before widespread vaccination, measles was a common childhood illness. Today, thanks to vaccines, measles is much less common. However, outbreaks still occur, especially in areas with low vaccination rates. Measles can be a serious illness, especially in young children. It can lead to complications like pneumonia, encephalitis, which is brain swelling, and even death. Understanding measles is crucial to protecting ourselves and our communities. The measles virus spreads through the air when an infected person coughs or sneezes. Tiny droplets containing the virus can linger in the air for up to 2 hours. You can get measles by breathing in these droplets, or if the droplets land on your eyes, nose, or mouth. Measles is so contagious that if one person has it, up to 90% of the people around them who are not immune will also become infected. You are considered immune to measles if you have had the disease before, or if you have been vaccinated against it. The virus can live on surfaces for several hours. Touching a contaminated surface and then touching your eyes, nose, or mouth can also spread the virus. It's important to practice good hygiene, like frequent hand washing, to help prevent the spread of measles. Measles typically begins with flu-like symptoms. These symptoms usually appear about 10 to 14 days after exposure to the virus. The initial symptoms include a high fever, cough, runny nose, and red watery eyes. A few days later, a red blotchy rash develops. This rash usually starts on the face, behind the ears, and then spreads to the chest, back, arms, and legs. The rash can last for 5 to 6 days. Other symptoms can include muscle aches, sore throat, and loss of appetite. Measles can be spread from 4 days before to 4 days after the rash appears. Complications. The hidden dangers of measles. Most people recover from measles without any serious problems. However, measles can sometimes lead to serious complications. These complications are more common in young children, adults over 20, pregnant women, and people with weakened immune systems. Ear infections are a common complication, especially in young children. Pneumonia is a serious lung infection that can be caused by measles. Encephalitis or swelling of the brain is a rare but potentially life-threatening complication. Measles can also weaken the immune system, making it harder for the body to fight off other infections for years after the initial infection. This can make people more susceptible to other illnesses. Prevention and global impact: the MMR vaccine and beyond. The MMR vaccine is the best way to protect against measles. The vaccine protects against measles, mumps, and rubella. It is a safe and effective vaccine that has been used for decades. The vaccine is given in 2 doses. The first dose is usually given to children at 12 to 15 months of age. The second dose is given between 4 and 6 years of age. Vaccination is crucial for creating herd immunity. Herd immunity occurs when a large percentage of the population is immune to a disease. This helps protect those who cannot be vaccinated, such as infants and people with certain medical conditions. Measles outbreaks still occur globally, highlighting the importance of continued vaccination efforts. Treatment and care: managing measles. There is no specific treatment for measles. However, there are things you can do to relieve the symptoms and support your body's natural healing process. Rest is important to help your body fight off the virus. Drinking plenty of fluids helps prevent dehydration, especially if you have a fever. Over-the-counter medications such as ibuprofen can help reduce fever and relieve aches and pains. If you suspect you or your child has measles, it's important to see a doctor right away. Early diagnosis and supportive care can help prevent complications. Measles versus rubella. Distinct diseases, similar concerns. Measles and rubella, also known as German measles, are both viral infections that can cause similar symptoms. Both diseases can cause fever and a rash. However, there are some key differences between the two. Rubella is usually a milder illness than measles, and its rash is often less pronounced. Rubella can be very dangerous for pregnant women, as it can cause serious birth defects. Both measles and rubella can be prevented with the MMR vaccine. Maintaining high vaccination rates is crucial for controlling the spread of both diseases.